Good day to all, and here I am once again, Miss Merle, to talk about RA 8504, known as the Philippine AIDS Prevention and Control Act of 1998. And although global commitment to control the HIV/AIDS pandemic has increased significantly in recent years, the virus continues to spread with alarming and increasing speed. Hence, preventing and controlling this pandemic is of utmost importance. This HIV law portrays the Philippine HIV situation as it describes the government policies for the prevention and control of HIV/AIDS. It highlights how essential voluntary HIV counseling and screening are. It tackles medical confidentiality and patient discrimination. Moreover, it gave clear definitions of the acts or omissions punishable under this RA. So, Republic or RA 8504 is an act promulgating the policies, and it prescribes the measures for the prevention. So think of this RA as more, it focuses on the prevention and control of HIV/AIDS in the national setting. It institutes a nationwide HIV/AIDS information and educational program and establishes a comprehensive monitoring system to strengthen the Philippine National AIDS Council, or PNAC or PNAC, because we have this council fully designated for the monitoring of the HIV status in our country's PNAs. And then what is AIDS? So, well, the basic thing is that this disease recognizes no territorial, social, political, and economic boundaries. It affects anyone. Anyone can get it. And there is the sad thing is, as of this moment, yeah, while research is very promising, but the clear-cut thing is there is still no known cure for AIDS. AIDS stands for acquired immune deficiency syndrome, or some would say acquired immunodeficiency syndrome. It is a chronic, potentially life-threatening condition caused by the human immunodeficiency virus. By damaging our immune system, HIV interferes with our body's ability to fight infection and disease. And the thing, this one is a sexually transmitted infection. So this is an STI and can be spread by contact with infected blood or from mother to child during pregnancy, childbirth, or breastfeeding. And without medication, it may take years before HIV weakens our immune system to the point that we have AIDS. And again, there is really no cure, but medications can dramatically slow the progression of the disease. And again, we have AIDS. So this is characterized by kind of a combination of signs and symptoms. So what are the symptoms of AIDS? But HIV infection has stages. It doesn't really fully become AIDS. It starts with the acute infection. We have the clinical latency, and the AIDS is the last stage of HIV infection, wherein it is already considered full-blown. And by the time that a person contracts HIV, this virus attacks and weakens the body's immune system. Specifically, it attacks CD4 positive T cells. And what is the end result is that the person with the disease is highly susceptible to other life-threatening infections. So what are the symptoms of HIV? So not everyone will have the same symptoms. It depends on the person and what stage of the disease they are in. So we have, again, stage 1 will be acute HIV infection within 2 to 4 weeks. So acute HIV infection, we have that stage 1 after 2 to 4 weeks after infection with HIV, and about 2/3 of the people will manifest a flu-like illness. Well, this is the body's natural response to HIV infection. And you might ask me, wow, flu-like symptoms can include what? So it include fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. And these symptoms can last from anywhere a few days to several weeks, but some people do not have any symptoms at all during the early stage of HIV. So please take note on that. And we also have stage 2, the clinical latency. During this stage, the virus still multiplies, but at very low levels. People in this stage may not feel sick or have any symptoms. And this stage is also called the chronic HIV infection. And without treatment, people can stay in the stage 2 for 10 to 15 years, but some move through this stage faster. So if you take HIV medicine daily, exactly as prescribed, and get and keep an undetectable viral load, you can protect your health and have effectively no risk of transmitting HIV to your sexual partners. But if your viral load is detectable, uh, sorry, you can transmit HIV during this stage, during stage 2, even when you have no symptoms. It's important to see your healthcare provider regularly to get your viral load checked. And we also have stage 3, is full-blown AIDS. So if you have HIV and you haven't received any HIV treatment, eventually the virus will weaken your body's immune system and will progress to AIDS. And AIDS is the late stage of HIV infection. So what symptoms of AIDS can we see? During stage 3, the full-blown AIDS, we have a rapid weight loss. So person becomes really emaciated or thin, and recurring fever or profuse night sweats, extreme and unexplained tiredness, prolonged swelling of the lymph glands in the armpits, groin, or neck, and diarrhea that lasts for more than a week, sores of the mouth, anus, or genitals, and pneumonia. Also, there are red, brown, or pink or purple blotches on under the skin or inside the mouth, nose, or eyelids, and that's known as Kaposis sarcoma. And then memory loss, depression, and other neurologic disorders. So you might wonder why this all of these things happen, because particularly HIV is a virus that attacks the CD4 positive T lymphocytes. And these lymphocytes are the helper lymphocytes. Once these group of cells are affected, there is really a severe weakening of the immune system. And then let's go to the definition of terms under this RA. So let's start with anonymous testing. So what is anonymous testing? So it refers to an HIV testing procedure whereby the individual being tested does not reveal his true identity. So to achieve this, an identifying number or symbol will be utilized to substitute for the name, and allows the lab conducting the test and the person on whom the test is conducted to match the test results in the identifying number or symbol. So you might ask me, what's the difference between confidential and anonymous testing? So take note, guys, all medical care that you receive should be confidential. Again, all medical care that you receive should be treated confidential. So this means that the information you discuss with your healthcare providers must stay in your files at the clinic and not be released to anyone without your permission. All testing and results are handled as confidential matters. So on the other hand, anonymous testing is when your name is not associated with the tests or the results in any way. You may be given a number or a code or a number or a symbol to identify yourself during testing and when receiving results. So speak to your healthcare provider about the testing process used. So if you're using numbers or symbols. And then what is compulsory HIV testing? So it refers to HIV testing imposed upon a person attended or characterized by the lack of vitiated consent. There is no use of physical force, meaning the person was not forced to do it. There is no intimidation or any form of compulsion. So one of the strongest grounds is the mandatory HIV testing infringes upon the human rights of people living with HIV. It threatens the three keys of HIV testing, namely consent, voluntary counseling, and confidentiality. So put a lot of people at risk because they would then loosen up. So mandatory HIV testing will be deemed unlawful under this law. is deemed unlawful under this law. So there's no such a thing as compulsory HIV testing, except in some circumstances stipulated by the law. And contact tracing. So this is the method of we're trying to locate and counsel the sexual partners of a person who has been diagnosed as having STDs or STIs. Because before in the past we use STDs, but in the present we are already utilizing STIs. So HIV contact tracing, also sometimes called HIV partner notification. So again, HIV partner notification. It is a practice of we identify, we locate, and we inform someone that a partner, they have had sex or used drugs which has been diagnosed with HIV. So the importance of contact tracing would be its aims to identify individuals who may be unaware of their HIV infection. So they may benefit from treatment and be provided support to affect sustained behavior change, thereby mitigating ongoing transmission of HIV. So HIV, the virus. So please, most of us are confused between what is HIV and what is AIDS. HIV is the virus that causes AIDS. AIDS is the last stage of HIV infection. So the human immunodeficiency virus are two species of lentivirus. Lentivirus, because we have HIV-1, we also have HIV-2. And lentivirus is a subgroup of retroviruses that infect humans. And over time, they cause AIDS, which is a condition, again, in which progressive failure of the immune system allows life-threatening and opportunistic infections and cancers to thrive. And without treatment, average survival time after infection with HIV is estimated to be 9 to 11 years, depending on the HIV subtype. And we have HIV/AIDS monitoring. And what's the difference between HIV/AIDS prevention and control? So monitoring is more on we document and analyze the number of HIV/AIDS infections, and we are trying to see patterns of its spread. While HIV/AIDS prevention and control will be on the measures aimed at protecting non-infected persons from contracting HIV and to minimize the impact of the condition of persons living with HIV. So next we have HIV positive and negative. It's very easy under this RA. The law stipulates or defines HIV positive individuals or a condition. It refers to the presence of HIV infection as documented by the presence of what? Positive because of the presence of the antibodies in the sample being tested. So here, this type of testing is we're looking for antibodies and not for antigen. So that's the thing. And HIV negative, meaning the absence of HIV antibodies or HIV upon HIV testing. But guys, take note, presence of HIV, this could be we are looking, for the antigen. And if we are really stipulating antibodies, or it could be we're looking for antibodies in the sample being tested. HIV testing is HIV is usually diagnosed by testing your blood. Commonly, the sample will be blood or a swab. A sample of the cells taken with a swab from inside your cheek for the presence of antibodies to the virus. And HIV tests vary in how soon they are able to detect infection. Please take note on that. And the time between you get the virus and when it can be detected is called the window period. So again, HIV testing, any lab procedure done on an individual to determine the presence or absence of HIV infection. And then transmission. As we all know, most common is through sexual intercourse. Well, HIV transmission refers to the transfer of the virus from one infected person to an uninfected individual. So for example, this one is infected, this one is not yet infected, and then there's a transfer. So how is HIV passed from one person to another? Most people who get HIV get it through anal or vaginal sex, or sharing needles or syringes and with other drug injection equipment. But there are powerful tools that can help prevent HIV infection. But I will be citing some questions that you might also be thinking. So, can you get HIV from anal sex? Yes, you can get HIV if you have anal sex with someone who has HIV without using protection, like condoms or medicine to treat or prevent HIV. Please take note, guys. Sexual intercourse and anal in the form of anal sex is the riskiest type of sex for getting or transmitting HIV. Again, anal sex is the riskiest type of sex for getting or transmitting HIV. And being the receptive partner, like some people would say bottom, is riskier for getting HIV than being the insertive partner or the top. And the bottom's risk of getting HIV is very high because the rectum's lining is thin and may allow HIV to enter the body during anal sex. And the top is also at risk because HIV can enter the body through the opening at the tip of the penis or urethra. The foreskin of the penis isn't circumcised, or small cuts, scratches, or open sores anywhere on the penis. And you might also ask me, can you get HIV from vaginal sex? You can get HIV if you have vaginal sex with someone who has HIV without using protection like condoms or medicine to treat or prevent HIV. Vaginal sex is less risky for getting HIV than receptive anal sex. Either partner can get HIV during the vaginal sex, and most women who get HIV get it from vaginal sex. HIV can enter the woman's body through vaginal sex through the mucous membranes that line the vagina and the cervix. Men can also get HIV during vaginal sex. This is because vaginal fluid and blood carry HIV, and men get HIV through the opening at the tip of the penis, the foreskin of the penis, if the penis isn't circumcised, or small cuts or scratches or open sores anywhere on the penis. Okay, and can HIV be transmitted from a mother to her baby? Well, HIV can be transmitted from a mother to her baby during pregnancy, birth, or breastfeeding. Take note, pregnancy, birth, or breastfeeding. However, it is less common because of the advances in HIV prevention and treatment. We call this the transmission from a mother to her baby is known as perinatal transmission or mother-to-child transmission. Mother-to-child transmission is the most common way that children get HIV. Recommendations to test all pregnant women for HIV and start HIV treatment immediately have lowered the number of babies who are born with HIV. And if a mother with HIV takes HIV medicine daily as prescribed throughout pregnancy and childbirth and gives HIV medicine to her baby for 4 to 6 weeks after giving birth, the risk of transmitting HIV to the baby can be less than 1%. And another question, can you get HIV from sharing needles, syringes, or other drug injection equipment? You are at high risk of getting HIV if you share needles, syringes, or other drug injection equipment, for example, cookers, with someone who has HIV. So if you are sharing those things with someone who has HIV, so remember, never share needles or other equipment to inject drugs, hormones, steroids, or silicone. Use needles, syringes, and other injection equipment.